Hi, I'm Pam Mansfield. I'm a palliative care physician working here in Moncton going on almost 16 years now. So we're going to talk about advanced care planning today. Advanced care planning is just really a way of thinking about if something were to happen to me, or when something happens to me, if I get diagnosed with a critical illness, or if I were to have an accident, what kind of medical care would I want to have? Is thinking about, what's important to me as a person and what kind of life is important for me for my quality of life, and what kind of medical treatments would I want to have, but what kind of medical treatments would I also not want to have. A lot of the times when you're in a critical illness or you've had an accident, you're not able to tell people or answer the questions from the physicians, like, do you want to have this treatment? Or in the extreme example, would you want to be put on a ventilator? Because often you are too sick to be able to make those decisions. And so it's about having those decisions made before you get to that critical time, and also having those decisions made in a time where you have time to think about what your thoughts and wishes and feelings are about these things. And so you're not making more of an emotional decision, you're making more of an informed decision. Everybody should make an advanced care plan. It's not just for the old people, because I've seen so many times where the family members and friends are the ones who are struggling to make the decisions for their loved one, but they've never had the conversation with their loved one, and so they don't know what decisions they'd want to make. And it often leads to a lot of hurt between family members when there's disagreements about what decisions should be made. And even after a person has died, it leads to a lifetime for some families of hurt and discord, because there was never agreement on what kind of treatment their mom or dad would have wished to had if people haven't had these discussions. And so everybody, no matter how young or old, anyone could be in an accident. Certainly if you're diagnosed with a life-limiting illness, then that's certainly a trigger that it's time to do an advanced care plan. I also say it's good whenever a life-changing event has happened. So if there's been, let's say, a wedding or a birth or even a death in the family or a new job or a new house, any kind of life-changing event is a good time to reflect on kind of what your wishes would be. So who would make the decisions for you if you're not able to make those decisions? We always say it's good to document, and that way the physician has an actual copy of what your wishes would be, and the healthcare team would know how to make the medical decisions based on what you want. But again, more important is having that person who knows what your wishes are. And so we call them the substitute decision maker, because they're not making decisions for themselves, they're the substitute to make decisions for you, as if you were still there. And I say to people, your dad made you the substitute decision maker, so you have to put yourself in your dad's shoes, and you're making decisions as if you're your dad. And so what would your dad want? Would dad want to have this treatment if it meant that he was going to live the last 3 months of his life in the hospital? Or would dad rather not have this treatment and come home and live maybe the last month at home? It's important for people to understand, when they are the substitute decision maker, that they are making those decisions for the person, not for themselves. So an advanced care plan is only used when a person cannot speak for themselves. If someone had an accident and they were in a coma, obviously they couldn't speak for themselves, and so the physicians would then go and talk to the substitute decision makers and talk to them about what wishes would the person who is sick want, what kind of treatment would they want. That's the only time an advanced care plan is actually used. If a person is able to communicate and speak for themselves, then they're able to make those decisions. But it's always a good idea for everyone to think about, okay, if I was in that situation, what would I want? So that when the time comes and the doctor does ask you, you kind of already have an understanding of what your wishes would be. There's this great website called advancedcareplanning.ca, and it's put on in part by the Canadian Hospice Palliative Care Association. It's easy, it's a click, you press on it, and it starts asking you these questions about how do I make an advanced care plan. And you can fill it out online if you want and print it, or you can save it, or you can print off a booklet that you can actually write in for people who like to write as opposed to being on the computer. When you are making your advanced care plan, make sure you have that substitute decision maker and make sure that you're always talking with them about what your wishes are. Because certainly what you think might be important to you today might change 5 years later. Like, let's say you're making that decision today as a 25-year-old and you don't have any children, but then 5 years later, let's say you have a child, and things that were once important to you were no longer important to you. And so of course then your decision would change. Or if something in your health changes, something that may have been a treatment option before may not necessarily actually be a treatment option now because things are different. And so yes, as your health changes, as your life circumstances changes, then your advanced care plan changes with you. So it's not something that's written in stone. So within Horizon, the Health Network, what we are trying to do is encourage advanced care planning with patients and their families. And so there is a policy that we call the resuscitation policy, which focuses on more of do not attempt resuscitation and what level of care you would like to have. And that's more very basic medical care. It's not really an advanced care plan in itself. But the first step is developing an advanced care plan and then kind of focusing your level of care based on what your advanced care plan would be. And so it's been a focus for the last few years that anyone who gets admitted to hospital, they are asked what their medical wishes would be. They're asking very basic, if something were to happen, what kind of treatment would you want to have? And so that's often extrapolated from an advanced care plan that's been done earlier on. Health changes every day, and we never know what's going to happen. And so it's important to have these conversations about if something were to happen to you, what kind of medical care would you want? And what is important for you as a person? And what's important for you may be very different than what's important to your neighbor. And so you may have two very different advanced care plans. The advancedcareplanning.ca website has a great tool to help you think about what's important. They have good questions and an easily downloadable workbook, or that you can fill it online. And it's really important to have this conversation so that it's really about protecting yourself and protecting your loved ones. And so that you know that the treatments that they're going to have is in keeping with what their wishes are, as opposed to them having treatments, or even yourself having treatments that are against what they would want if they were able to speak for themselves. And remember, an advanced care plan is only ever used if you're not able to speak for yourself, and if it's there as a backup. Because if you're able to speak for yourself, we can have these conversations one-on-one.